what most of us do is we choose the guide first. We approach a guide and so I want to do an ICMR STS under your guidance, and but we approach them without any question in mind. That we do quite often. That is fine, but guides would appreciate more if you come up with some research question. You have something in your mind. You may or may not convert your research question into a protocol. You may have a different question altogether later, but at least you have thought of a research question, or at least you have some interest in some area to work on. That's what I think guides would like students to come up with. And to find a topic or a research question, you need to be very observant. Should have a habit of reading, habit of questioning everything, attending online CMEs and lectures. That will give you something about some research questions in your mind. You can also do a quick brainstorming with your friends on a broad topic, so that you narrow down on a specific research question. You can do quick Googling, PubMed search on what people have done on that topic and what I can do on this topic. And then you can approach a guide with some questions in mind. You may not have a very clear research question when you approach a guide, but at least you have some rough idea of the topic or area on which you're going to work on in this program. So it's always good to have some questions in mind when you approach a guide. But of course, you can anytime approach a guide if you do not have a research question, and surely the guide will guide you in finalizing your research question. Next slide, please. Again, the next question that is most commonly posed is which topic gets selected. I think there is no clear answer to this as well, but I'll tell you something. The first line, what I've written, any question that you have in your mind. It's not any random question that you have in your mind. It's a specific, clear question that you have in your mind. And there is no particular topic or domain which has a very high chance of getting selected. But if you ask a question clearly, and if you be very specific in your research question, I think that increases the chances of being selected. You can also ask a question whether this question will help my patients, whether this will help people, community or not. Just a simple question, does it help my patients or community? It may not be helping patients in a large geographical area, but at least even locally, if it helps patients in your local hospital, in your particular area, that is also a good question. The only point I want to overemphasize is do not go for novelty in ICMR STS. ICMR STS is not looking for a novel research question, the first in the world, somebody has not done it. If there is a novel question, that is good, that's bonus, but do not go for a very novel question because every year 1500 to now 2000 ICMR STS will be awarded this year, and you cannot find thousands of novel questions every year. So it's not that a novel question will always be selected. It is a clear research question with a clear and sound methods to achieve the research question. That's what will get selected. I think the role of guide here is important to make the research question very clear without any ambiguity, and your methods should always be linked to your research question and your objectives. And a lot of a varied array of disciplines and research topics have been selected. A lot of topics in the domains of not only public health, in clinical domain, a lot of research questions in the laboratory domain, a lot of questions have been selected. So I would say there is no specific area domain which has a very high chance of getting selected. Earlier, these research protocols were being reviewed by non-technical staff, but I think in the last couple of years, things have changed within ICMR, and these protocols are now being reviewed predominantly by the technical staff. So it is more important that you frame your research question, your objectives very clearly, and have a very sound method to answer your research question. So I think that's what gets you selected. The only domain, but I'm not saying that you should go for this domain, but the domain that I have seen have picked up recently is in the field of yoga, meditation, mental health. I'm not saying you should go only for these domains, but these are some of the domains which have uh, picked up in the last few years, and people have got ICMR awards on these topics. Yeah. Next slide, please. Again, as I have already said, what's new this time? This time onwards, you get 2 to 3 years for the execution of projects. Not exactly 2 to 3 years, because then you also have to complete or finish your curriculum, medical curriculum. You give your all your professional exams. But I think you have 3 summer vacations. That's what ICMR STS wants you to utilize your summer vacations in carrying out this project. As I said, the first summer vacation to write up a protocol, and if you get selected in the second summer vacation, you collect data and present an interim report. And in the third summer vacation, you finish your project and submit a full and final completion report. Now, with this change, the scope of the project is slightly different. I would say that you should always think of a research question which should be relevant after 2 to 3 years. Now, something which is very relevant now may not be relevant after 3 years when you finish the research question, finish your project. So, like during COVID, if you propose a topic on COVID, that's fine. But if you're going to complete the project after 3 years, then maybe it's not relevant after 3 years. So just think of a topic which is more general and retains its relevance even after 3 years, and also have a plan for 2 to 3 years. How are you going to spend your uh, 2 or 3 summer vacations? And you should have adequate plan for those 2 or 3 summer vacations. Next slide. The key features, as I have said, it's an online application process. Everything is online. It begins with your submission of the protocol. This summer vacation, you have to submit your protocol by 31st of May. That's the deadline. And then next summer vacation, you have to do some data collection. And then the third summer vacation, you have to finish the final project. So you get around 6 months of vacation in 3 years to finish your project. Of course, you are free to work in the evening hours. If you can collect data in the evening hour, that's completely up to you. And you get a stipend. I'd say it's an award of rupees 60,000 in 3 installments, 15, 15, and 30,000. And surely these projects must get approval from the IC, and clinical trials are not really encouraged under STS program, because the likelihood of finishing a clinical trial within these timelines, keeping in mind your curriculum, is generally, feasibility is less. Next slide, please. The most important part now you should focus on is the concept note or the proposal after you have finalized your research question or your title. And these are the components of your research proposal, which you have to draft and submit it online. You will get a reference to register on the online platform. Then comes the title. Title is important because title is a way of catching somebody's attention. You need not be very creative in your title. I'm not saying use very catchy phrases and be very creative in your title to catch somebody's attention, but of course you can use some of your creativity in having a nice decent title of then 25 words which describes your objectives, at least your primary objective, very clearly. Then you have your introduction, objectives, methodology, implications, references. There are word limits for each of these sections, and because it is an online system, it will not allow you to copy and paste an introduction more than 400 words. So these limits are very rigid, and you have to follow these word limits. Otherwise, at the time of submission, if you have a 500-word introduction, it will not allow you to move ahead. So you have to follow these word limits, else you will not be able to move ahead. So we'll talk about these sections in the next slide. Next slide, please. Now, title should be short, accurate, concise, and most importantly, it should clearly describe the primary objective of the study. Now, every study has predominantly, you should have a key primary objective of your study. You may or may not have secondary objectives, but every study must have a primary objective, which is the main focus of your study. And your title should exactly clearly describe the primary objective of your study. Now, introduction, I would say introduction is something which most people do not read the entire introduction, especially when they review a protocol. But it is important for you to understand that why have you taken up this research question. Now, any introduction begins with the general problem, and then you jump on to the specific question you are trying to address. Give you an example now. If you want to focus on diabetes, and diabetes is your broad area, and you say, what is the problem with diabetes in India? And then you jump onto the specific question. Now, in diabetes, what are you looking at? Suppose you are looking at why people are not taking drugs or why they're not adherents. So you jump on to the specific question of adherence to anti-diabetic medicine. What is that a problem? If you're looking at infant mortality, so that's the big general problem. And jump on to the specific question. The specific question is pneumonia causing infant mortality. So first, look at the general problem, jump on to the specific question within the broader problem that you're trying to address. Then you try to say in few lines what has been done on this topic before. So people have done something on pneumonia causing deaths in infant mortality, or people have done something in why people are not taking anti-diabetic medications. So if people have done something already, what are you trying to do? So then you try to find out what people have not done. So what is the gap in previous research? If people have done XYZ on this topic, but they haven't touched on that some particular aspect. And so that's what something new in your study, and that's how people market or publicize their study, that okay, these studies have looked at only adult diabetic patients, and they haven't looked at elderly, or they haven't looked at young diabetic cases. So my project is new in the sense that I'm looking at younger patients, or they have looked only on patients with hypertension and diabetes. Or so what's new in your comes from previous research. And then once you know that something is new in this, then you conclude your introduction with the objectives that okay, this is what I'm trying to do because this is something new. In ICMR STS, you need not come up with a very new question which somebody has not done ever, right? So again, I want to stress that novelty is not an essential requisite for ICMR STS. They're not looking for a novel question, especially from young MBBS students. They are actually looking for a clear research question. Okay, so be clear in what you are doing, and your objective should be clear, very specific. What you're trying to do, should be able to measure that, and the most important thing is you should be able to achieve your objectives within these few months of data collection and project completion. So if you can demonstrate that I have 2 or 3 clear objectives and I can finish these objectives within these few months, and you have a plan how to finish your protocol, your project in these few months, that's a good protocol for you. Next slide, please. Methods, I think the two most important sections in your protocol, first is your the objectives and then your methods. And methods should always be linked to your objectives. If you want to achieve something, you have to write your methods in a way that you achieve those. And these are some of the sections which you can follow in order to finish your method section or draft your method section. You should write your study setting and study design. Please remember, in ICMR STS, I've seen a couple of students not getting a final completion report. That is also quite new for me a couple of years before. That students were not qualified for the final report was not considered complete because they had revealed the name of the institution in the report. Now be very mindful of that. It is clearly written in the ICMR STS guidelines that you do not reveal the name of the institution in your report, or I think in your protocol as well. Do not say that I'm doing this study in AIIMS Nagpur. I think it would be nice to say that I'll be doing this study in a central institute, in a tertiary institute in central India. So be cryptic in the way you present your setting. You can say that I'm going to do a study in Delhi, in Nagpur. That is fine, but do not specify the exact name of the institute where you're working. Even if you're doing your study there, don't write it explicitly in the report, because there have been issues with some of the findings from various institutes. So ICMR doesn't want to get into that problem, that institutes will come and complain, so they don't want to get that problem. So do not specify the name of the institute in your study setting. You can just say that in a tertiary hospital in the state of Jharkhand or Uttar Pradesh, whatever, that is fine. Study design is important. You have to say whether you are adopting a cross-sectional design, you're adopting a cohort design, or a cross-sectional survey, whatever design you are using. Clearly say that. Whom are you going to recruit in your study? Is your study population? Are they males, females, elderly, age group 18 to 45, children in belonging, or infants 0 to 1 years, or adults admitted to my hospital during January to December 2024, or patients with pneumonia in the OPD during in the year 2025. So be very specific in your study population, and your study population should contain who, when, and during what time period, age groups, and all these things you have to mention in your study population. Then roughly how many are you going to intake? That is your sample size. Is it 100? Is it 200? Is it 1,000? Is it 400? Again, you talk to your guide, or if there is a statistician, somebody from community medicine statistician, your guide will help you in calculating the sample size. Be very careful when you propose a sample size. Don't make it too big so that it seems not feasible. Don't achieve for something which will look difficult to cover. So if you say I'm going to interview 1,000 patients, 1,200 patients, and you have a long questionnaire, so then again the chances of your project getting selected comes down. So choose your numbers carefully so that it remains feasible. And then also you also have to find out how are you going to get those numbers. If you want 400 patients in your study, how are you going to get those 400 patients? From which department, on which day, how are you going to sample them? Do you have a list of those patients who were admitted to your hospital, or do you have a list of people in the community who are going to approach? or you do not have a list, you're just go into the hospital or in the community, you go to each household. So how are you going to sample is part of your sampling. So these two are important. How many is the sample size? How are you going to recruit those is your sampling. Now, if you have an intervention, please say what is the intervention. Generally, interventional studies are not encouraged in ICMR STS, again, because it will take time. But if you have a very clear, simple, specific intervention, you can demonstrate that you can finish this work within the time frame, that's fine. What are the data collection procedures? Who is going to collect data? How will you going to collect data? Are you going to the field? Are you going to the hospital? Your OPDs, IPDs, patient homes, attendants, medical students, faculty. So tell very clearly whom are you going to interview? What is the data collection pro forma or the questionnaire you're going to use? Are you going to use some scales? Put that scale, give your case study form, data collection pro forma, and have a clear plan of analysis and all your consent forms ready, because these case study forms, data collection instruments, consent forms will have to be uploaded onto the online platform. So you have to be ready with these formats as well. Next slide, please. Implications and references. I think in a very brief, you have to say what are you going to gain from this research in terms of your gain in knowledge, or your gain in terms of scientific advancement, or anything new you want to add to the literature, or anything new your study is going to give some evidence, or your study is going to benefit you. So both the implications. So implications in terms of your gain in knowledge, and implications in terms of giving more to the scientific body of evidence. Okay. And references, again, go through the guidelines. It says you have to provide references in Vancouver style. Don't give a lot of references. Give only references which are relevant and recent and relevant to your topic. Next slide, please. A research project. So studies which are feasible. That means you should be able to finish it within timeline. Ethical and methodologically correct. So right method, correct objectives, and feasible objectives have higher chance of getting selected. Don't aim for novelty. If you have a novel question, simple novel question, that's a bonus. But don't go for a novel question unless there is one, or don't go for big numbers, sample size. Always consider feasibility. Next, please. Now, because the ICMR knows that you already have a tough medical curriculum to finish. Okay, you have to give your exams, and many students utilize summer vacations. Some of them read. There are exams before or sometimes after summer vacations. So summer vacations can be utilized for reading as well. So ICMR is well aware of the fact that you have to finish your curriculum. You have to give your internals, so many small tests. You also have to read for your final PG exams. So in between, amidst all these exams, curriculum, classes, practicals, you have to finish this. So ICMR is well aware of that. So be mindful of that. This is probably your first research project that you're going to do, and ICMR wants you to be small, feasible, clear, and be able to finish it within the timeline. And yes, of course, you need your study questionnaires, you need your informed consent form, participants, information sheet, and IC clearance is very important before you take up any data collection. Now, at this stage, you may not have an IC clearance, but you can your guide can give an undertaking that you will submit this proposal to the IEC, or if you have submitted to the IEC, you can give an undertaking that we have submitted it and it is under consideration, and if the project is approved, we will obtain IEC clearance before initiating the study or before data collection. So that undertaking can be given by your guide because that is also required when you are submitting the online form. Okay, so I think most of you will not have an IEC clearance now, so you will need a guide undertaking from the guide. Next. This is, of course, a wonderful way exposure to medical research at a nice juncture of your career. It is first year, second year students entry into medical field, and an early exposure to medical research will be very useful in your career. And it will also give you you work with your supervisors on your guides and your guides on the similar projects. You'll be able to secure some good letters of recommendation. Who wants to go abroad to some other courses, you can also get some good letters of recommendations. Next slide, please. And as I said, of course, having an ICMR STS is also a good enhancement to your CV. And most of the STS students not only stop at completing the project and getting the award, most of them go ahead with a publication. You can have a good publication once you finish up your project, and that is again an enhancement to your resume or your CV. Next, please. Just the last couple of slides. Do's and don'ts. I think be careful, be meticulous, avoid the last minute submission on the 31st of May because the online system sometimes can put you off. There are very strict no word limits, and be very careful with those word limits and avoid the last minute thing. It's good to submit on 29th and 30th of May rather than waiting for the 31st of May. Be very clear and honest with what you are doing. Go through the entire process of research by yourself. Your guide will always help you, but if you go through the process of research by yourself, you will learn a lot. Be in constant touch with your guide and follow the methodology that you had promised in the protocol rigorously, because if you don't do that, and if there is a significant difference in your project completion report and your project protocol which you had initially submitted, and because you haven't followed the methodology properly, if there's a clear difference in both these, then your final completion report may not get accepted. Okay, next, please. Yeah, so that's what that's those are the slides I wanted to present, and now we can you can have a question answer, or maybe Dr. Agarwal would like to say something.
Dr. Jaya was very well covered. Thank you very much. And I think a lot of people are motivated to submit their projects now in next maybe 2-3 weeks. So I think a lot of people have raised their hands. So we can call them one by one and they can ask the questions.
Sure.
Thank you so much, Dr. Professor Jaya Prasad Tirpathy, sir, for the insightful and informative session on ICMR STS program. Your guidance on the overall application process has been truly valuable and enlightening for all of us. We would also like extend our heartfelt thanks to Colonel Dr. Vivek Agarwal, sir, for joining us in the event. I would also like to thank all the faculty members and organizers who supported this event. Now, I would like to open the floor for the questions. If you have any queries or need any clarifications on anything that's been discussed, please feel free to type them in the chat and we'll take them one by one. And meanwhile, feedback form will be shared. Kindly please fill that form as well.
Chat is disabled. Chat is disabled.
Yeah, I'll do it. Sorry, sir. Yeah, you guys can type your questions in the chat box.
I think some of them have raised their hands. You can ask them to ask question to.
Okay.
Meantime, they can ask questions. Yeah.
Okay, you can, those who have raised their hands, Vatsalya, Saurav, Mani, Vatsalya, yes.
Okay, so Vatsalya has asked regarding the ethical clearance, do we need IEC approval for that as well?
Okay, so during submission of the protocol, obviously, I think most of us would not have an IC clearance. So in that case, the guide can give an undertaking that this is under consideration, or we will be submitting this protocol to the IEC, and before data collection, we are going to have IEC clearance. So that undertaking can be given by the guide, and then in the next vacation, when you submit your interim data collection report, you can submit your IEC.
Okay, thank you, sir. Now, Prachi has asked how to decide a sample size for a project. Is there a certain formula or is it randomly chosen?
Okay, so now sample size calculation, I think I cannot take a session here on sample size calculation because it has to be carefully chosen. There are formulas to work out, and it again depends on what is your research question and what is your study design. I think you can work with your guide. You can take help from some other statistician or somebody from the community medicine department in your institute to get that sample size. But that itself is a huge session to take. But yes, you need to clearly specify how many you're going to take and how have you arrived at those numbers.
So Anshu Kumar has asked a question that what if our institute does not have official summer vacations?
So summer vacations are just, uh, gives you ample time to work on your project work. But if you do not have official summer vacation, then I think you have to work during your evening hours and maybe during some odd holidays, and so you can carry on your work even during non-summer vacation months, during holidays or post evening hours, morning hours, and maybe take some permission from your faculty on some days to collect data from your hospital, from the community. So that's how you have to manage if you do not have official summer vacations.
Thank you.
And let me tell you that so most institutes give official summer vacations, mostly 1 month, I think so. But it's not that most of the students do their project work during summer vacations. I don't think most of the students spend their summer vacation at home, take a break, and when they come back, they utilize the evening hours, take permissions, or in the morning hours to collect their data. It's not that students completely spend their summer vacation on these projects. Yeah.
So the next question is by Ishita. She is asking what all documents are exactly required for IEC clearance.
So IEC clearance in general, you require a protocol, you require the case study pro forma, and you require your informed consent forms and patient information sheets. This is the basic requirement. But then as per your institute's requirements, you may have some additional forms or some cover letters or those things to fill up. But the protocol, your study questionnaire, uh, and your informed consent forms and patient information. See, these are the basic requirements for submitting to IEC. And even if you are, so you are not submitting, you may not submit your protocol to the IEC right now, but in the online platform for ICMR STS, you have to submit your case study form or your study questionnaire. You also have to submit your consent forms. So please log into your register in your online platform, log into your platform and see what are the documentary requirements so that you are not stuck up when you are trying to submit on the 30th or 31st of May.
So, thank you, sir. Next question was from Mansi Tiwari. He's asking, what if we finish our project early? Can we submit it before the final year?
I don't think so, because the ICMR will have some timelines for you to submit your reports. Maybe you have to wait for those timelines. So they will open up their portal for submission of the final project report.
Yeah. So Soumya Rani Reddy is asking, hello, can a foreign medical student apply for their ICMR STS?
I think it's clearly mentioned in the ICMR STS guidelines that foreign medical students are not eligible for this program. It's very clearly written in the guidelines.
Okay. Tarun Kumar Singh, he's saying, I'm a faculty in the Department of Dentistry. So can MBBS student submit their STS under me?
So there is no clear guidelines regarding this, that who can guide whom. Now, MBBS student being guided by a dental faculty, I don't see a problem, because there is nothing on paper regarding this. Okay. Now, an MBBS student can be guided by faculty from any department, right from anatomy to physiology to super specialties, urology, cardiology, any department. Now, why not by a dental faculty? So I don't see that this is a problem.
Okay, so the next question is by Shardul Rathore. He's asking, can we extend the data collection duration to a period of about 5 to 6 months? Sample size for unusual clinical cases can't be taken under 2 months duration.
Can you repeat the question? Is there in the chat box?
Yeah, it's in the chat box. He's asking.
By whom?
Shardul Rathore. He's asking, can we extend the data collection duration to a period of about 5 to 6 months, as sample size collection for unusual clinical cases can't be taken under 2 months duration.
Okay. Yeah. So the timelines given are, it's not that you only have to collect data during vacation. If you have a plan of data collection, like from January till January to June, but it will not involve it will not affect your day-to-day classes and courses, exams. And because these are unusual cases, so you will not have a lot of them. But the only thing is you have to wait for those cases to come. I think you can maybe put a small paragraph on how much, why do you need a longer period data collection, and how you can finish your data collection without really affecting your routine activities. Okay.
So the next question is by Vankardi Yug. He is asking, suppose we had a novel topic and cannot find enough content for proposal writing on PubMed. Can we write it on our own?
Yes, can you come back again? What's the question?
He's asking for if we have a novel topic and we cannot find enough content to write on the PubMed, so can we write it on our own?
Sure. I think you should go ahead then. If you have a novel topic and it is feasible for you to finish that within the timelines, and I think you should go ahead and write. It's not always that if something is written on PubMed, only then you will rewrite it. You should go ahead with that. You can take the help of your guide to draft the proposal.
Okay. So the next question is by Ishan Bhardwaj. Would a sample size of 150 to 200 be considered too large for a retrospective study? Also, do we keep aims and objectives as two separate sections, as a word limit of 100 is too little to include both aims and objectives? Can I keep aim as last sentence of my introduction or something?
Yeah, I agree with you. You can keep aim as the last sentence of your introduction, and you can have 1 or 2 lines of objectives in a separate paragraph, because I think in the online portal there is a section for introduction and there's a separate section for objectives. So don't put aim and objectives together in the objective section. And regarding sample size, it's difficult to say whether 150 or 200 is sufficient or not. It again depends on your question, depends on your sample size calculation that you have done, and depends on how much of data you are going to collect. If it is a huge data for each and every patient, it might be a big exercise. But I think 150, 200 is always achievable. That too with secondary data, it is always achievable. I don't see a problem here.
Okay, the next question is by, sorry, just a second.
Albert Edison, reference, how should I add them in my proposal? So,
Okay.
for Albert Edison is asking, reference, how should I add in my proposal?
So reference, the guidelines are to use Vancouver. So it is good to use one of the reference management softwares like Mendeley or Zotero, because that saves a lot of your time, and you also learn a skill of how to use references in a document. And it's good to use one of them. If there are 5 or 7, 8, 10 references, you can do it manually, but I would still go for reference management software, because you learn a skill and then you'll use that in subsequent in documents as well.
Okay. Then, so we'll take Q&A for only 2 more minutes as we are running out of time. So the next question is by Vinay Kumar. He's asking, what is case study form?
So case study form is like a questionnaire which you're going to ask to your participants. No, what is your name, age, sex, your occupation, you are suffering from diabetes or not, what is your sugar level. So it is a questionnaire, okay, which you are going to ask to your participants. That's the case study form.
Case I Siddin is asking, what should we exactly write in timeline? Have written as 1 year, is it, having written it as 1 year, is it fine?
I think it is good to give a breakup of, because ICMR has said that now you are proposing a protocol. They will take few months for getting it approved. Once you have approved, you have to go for IC. So you give some time for IC approval, and then you have a couple of months for data collection in the next year. So maybe you can break it up into IC approval, your data collection, data analysis, completion of project report. You can divide your tasks into these subdomains, and then for every activity you allot some time. Okay, maybe your data collection can also have, if you have 2 or 3 questions, you have to collect data from the records. You also have to ask or interview people and break that into record review 1 month, interviews 1 month. You can break it up.
So Anupam Utsav is asking, if my guide is from another department and my title is from another department, will that be a problem?
So it's the question is, if your guide is from another department, so how is he interested in a question from another department? That's the first question. So why is he interested in some other topic from other discipline? But of course, there are research questions which are not limited to only one department. Certain things which can be taken up by multiple departments. In that sense, it is okay. But if there's a topic which solely belongs to a particular department and doesn't at all belong to some other department, then then why would the guide be in that topic? That's my question. But there are some topics which come in multiple departments, which can be done by multiple departments. In that case, it is okay.
Okay, so the next question is, can you please confirm what study period for 2020 batches, the tentative schedule extends beyond our internship? Also, is case study form necessary for all studies?
Extends beyond your internship. I don't think it will not extend. Go back, look at your guidelines, STS guidelines, take a printout of it. It's a 1-pager guidelines. So it clearly says that first professional students have to work from first to third professional years, and second professional students have to work from second to fourth professional years. So it will not go into your internship. That's for sure. So it's clearly written in the guidelines. Go back and read. It's first prof for first to third prof years. Second prof will carry out their work from second prof to fourth professional years. Okay. And what was the second part?
Is case study form necessary for all studies?
Case study form is necessary for almost all studies, yes, because and that is also a mandatory document, I think, which you have to upload the online platform. Because anyhow, you're going to collect some data, no? So you have to collect that data on paper. You may collect data on your mobiles also, but you should have a printout of those questions so that you need to upload that on the online platform.
Okay, the next question is, what should we write as our study period, 6 months or 3 years?
That is a tricky question. It's not at all. 3 years is difficult to say. You cannot justify that you're going to collect data for 3 years. My take would be to divide your data collection period into different years. Now, what are you going to do in your second year or third year, or maybe 2 months for this, 2 months for this? Break it up and break it up into parts, and then say that the first part of my project will be done in this year, second part will be done in third year. Do like this. Have a timeline, and not 3 years. So that becomes a huge. That becomes a 3-year long project, which is it doesn't come under an ICMR STS project.
Okay, so the next question is, can we conduct the research which is already done in foreign countries but not in India?
So as I said, don't go for a very novel question. As I see here, a study done in foreign country and without any evidence is India. It's itself a good novel question, because India and foreign countries are so different. You cannot say that whatever done abroad holds true for India as well. And so in this case, I think somebody who has not done in India, it becomes a very good novel question. Even within India, if somebody has done it, you can still do it in your setting if you think that your setting is different.
So the next question is, does ethical clearance needs to be taken and submitted along with proposal submission, or can it be submitted afterwards?
So I've said this already, that during the submission of proposal, the guide can submit an undertaking that the proposal has been submitted to IC and is under consideration. Or you can say that once the proposal is accepted, we will submit it to the IC and we will initiate the project only when IC approval is granted. That undertaking can be given by the guide, and you can upload that undertaking instead of the IC approval now.
Okay. So we have 3 more questions. One is, what should be the content of interim report as pre-final and final year MBBS students? Since we cannot opt for STS projects, what else can we do to get standard experience in research and publication that also adds up to our CV, and how to do it?
For third year and fourth year, yes, you do not have an option of ICMR STS. But I think if there are students who are still interested in going through the process of research, I think then you contact any guide in your institute and try to work with that guide on a particular topic. I'm sure the guide will also be happy in getting some people to work with him. So there are sometimes you don't have much hands to work with. If you work with your guide, the guide will also be happy in engaging you in some of his research or in some other research that you both together work on. I think that's the only way.
I think even the university also now give some grants for research. So then with university also you can explore if your university, medical university is giving some grants for research. That can be explored, and the guides are definitely available. You can go to the department and start up with that.
Sure.
So there is a last question. Sushant wants to ask a question. Sushant, can you please?
Good evening, sir. Am I audible?
Yes, Sushant. tell me.
Yes, sir. Like last year, we had two different programs. One program was for the first and second year students, and another program was for the third year students. And there was not a specified timeline provided to us by ICMR. And they just mailed us you have 1 year time and you have to submit a report after 1 year.
Hmm.
So when we are supposed to submit the interim report and the final report?
For third year, who submitted last year?
Yes, sir.
I'm not able to. I'm not in a position to answer that because I think ICMR will come up with some notification on that. I'm not
Okay,
sure
sir.
what are the timelines for that, because I think that was the last time ICMR took out something on for third years. I don't think they are going to come up with the same proposal for third years this time. And that was done only last time, so that they give a last opportunity for the third years. And I'm not sure of those timelines.
Okay, thank you so much, sir.
There's one more question. What should be the content of interim report?
No, according to the guidelines, it says interim report is about whatever data you have collected. You just write that I have done this much of work. Whatever work you have done, you may not have completed your data collection, but you suppose you had to collect data from 100 patients, but you have completed 35 of them. So just present that you have done this. You have taken IEC clearance. You have taken whatever approvals. You have finalized the questionnaire. You have collected data on 35 participants, and these are some of the results. So that's what is the content, should be the content of interim result. Whatever work you have done till that point of time should go into a report.
Okay, sir. Thank you, sir, for answering all our questions. I hope all your doubts have been clear by now. So we'll move forward with our webinar. So I would like to give you a brief update on the upcoming event, which is going to be organized by IAGSC, that is PRISP, standing for Program for Research and Integrated Scientific Mentorship Program. It's one-on-one research mentorship program, which is exclusively for IAGSC members. It's a flagship program of IAGSC, Research Mentorship Program, where we provide a platform for students interested in carrying out research activities. So moving forward, lastly, I would like to give a shout out to all those people who have contributed for our posters. It was Aditya Kunal, Instagram B, Latika Janab, PPT design and Google form by Swapnil, and PR was Shinam Nair. And special thanks to our core team for their support and guidance in organizing this webinar. So lastly, I would like to invite all those people who are not the member of IAGSC. This is our membership drive. You can be the IAGSC member and be a constant part of all those activities which are being organized, and be a contributor for the geriatric health. Thank you, everyone. Thank you, Jaya sir, and thank you, Vivek sir, for joining in us and for all your valuable guidance and insights. I hope everybody will have benefited with us. Yes, sir.
Thank you very much.
Yeah, thanks a lot. Thank you for this was a wonderful organization. You have done a good job. I think the team of IAGSC is doing a good job, and good to see a student chapter within an organization, and good to see young active medical students coming together as a student chapter and organizing such events for other graduates. Good luck.
So, thank you, Dr. Jaya, for sparing good time on Sunday evening for this event. And it was a very, very knowledgeable. People have definitely benefited from your presentation, and they will definitely more and more people will apply for this STS grant. Thank you.
Thank you, sir. Thank you, sir, for inviting.
Thank you so much, sir, for joining in. Can I request everyone please switch on your cameras so that we can have a group photograph for this event?
I'll stop presenting.
I also request all the participants that the feedback form is live. Please fill it as soon as possible. We'll collect the responses till 10 minutes after the meeting.